There. Okay, so today we're gonna talk about something nursing. We're gonna talk about atrial flutter versus atrial fibrillation or A-fib. So what's the difference? Atrial flutter and A-fib or atrial fibrillation are both supraventricular tachyarrhythmias, which basically mean that they are abnormal heart rhythms that start in the atria. How they differ is they differ in ECG patterns, rate regularity, and clinical implications. For atrial flutter, the rate is 250 to 350, while atrial fibrillation is 350 beats per minute to 600 beats per minute. And ECG patterns, atrial flutter is just like sawtooth, it's just like this. But for atrial fibrillation, it's much more chaotic. It's just like everywhere, like popcorn everywhere. And the risk for thromboembolism is present in atrial flutter, but it is highly present. It is most likely present in atrial fibrillation, and they most likely require anticoagulation assessment. Rhythm for atrial flutter is regular, and for AFib, it is commonly known as the rhythm being irregularly irregular. That's how chaotic it is. The often causes of AFib, it could be multifactorial, meaning it can come from health issues such as hypertension, heart failure, coronary artery disease. It could also come from lifestyle if there's a drinking problem, caffeine, smoking, and it could also be genetics. So it could be there could have been a history of atrial fibrillation. There could have been a history of atrial fibrillation or aging, because the risk of AFib increases as age increases. All of the treatment is to prevent stroke from taking place and also to regulate the ventricular response and to regulate the heart, just so it'll have 100 beats per minute. Pharmacology-wise, cardiac glycosides like digoxin can be used to treat AFib. Cardiac glycosides are known for ventricular response, so digoxin can and sometimes used to prevent or to treat AFib. So pharmacology-wise, for heart rate control, calcium channel blockers such as diltiazem and beta-adrenergic blockers such as metoprolol can be used to regulate the heart rate. So these are the treatments for AFib. Some little recap. Repetitive rhythms are not seen in AFib because AFib is known to be irregularly irregular. So no regular repetitive rhythms are seen for AFib.